Today we have with us Dr. Prashant Bobhate. He is a distinguished pediatric cardiologist in Mumbai Kokilaben Dhirubhai Ambani Hospital with 15 plus years of experience in managing complex congenital heart conditions in children. Dr. Bobhate also heads the pulmonary hypertension clinic at Kokilaben Dhirubhai Ambani Hospital for both adults and kids. He is trained in India and Canada. His experience spans fetal echocardiography, neonatal heart care, and pediatric cardiac interventions. Widely recognized for his work in pulmonary hypertension and transcatheter therapies, Dr. Bobhate combines clinical precision with a deep commitment to child-centered care, making him a trusted name in pediatric cardiology. Welcome, Dr. Bobhate. So, what if a baby is born with heart disease? What are the survival chances? The family is in a panic situation. What is your say?
So, survival of a baby with congenital heart disease depends on how quickly it is diagnosed. If it is diagnosed in time and treated in time with either a surgical therapy or some kind of medical therapy or some kind of intervention which is done in the cath lab, most of these children can lead a near normal quality and quantity of life as well. The key here is diagnosing early and initiating a treatment early so that the baby's hemodynamics are maintained before we do the procedure. Once the baby becomes sick and then we go to operate, then some of these babies then can have respiratory problems which are there. So the heart may get cured, we may completely cure the heart, but already if the baby has got damage in the brain, liver or kidney, those things can remain over a period of time.
बहुत बार होता है कि ना बच्चे पैदा होने के बाद ही तुरंत डिफेक्ट होता है या सूरत जैसे दूर होता है दिन में छेद इसका क्या आपको देखना है?
तो दिन में जो छेद है ना, ये बहुत जेनेरिक है. दिन में छेद अलग अलग टाइप के छेद हो सकते हैं. तो दिन में बच्चों में हार्ट डिसीज होते हैं, विकार होते हैं, बहुत अलग अलग टाइप के होते हैं. इसमें सिर्फ छेद होता है, जिसके ऊपर वाले हिस्से में छेद होता है, जिसके नीचे वाले हिस्से में छेद होता है, या जो शरीर की बड़ी धमनी है और फेफड़े की जो धमनी है, दोनों के बीच में कनेक्शन होता है. ये यूजुअली सिंपल हार्ट डिफेक्ट्स कहलाते हैं. एंड इनको अगर एक बार ट्रीट कर दिया जाए तो बच्चे को आगे जाके ठीक हो. कुछ ऐसे हार्ट में प्रॉब्लम्स होते हैं, जैसे बच्चों की धमनियां हैं, वो जो फेफड़े की धमनी है वो नॉर्मली हृदय के राइट साइड से आनी चाहिए, वो लेफ्ट साइड से आती है. और जो शरीर की धमनी है जो नॉर्मली लेफ्ट साइड से आती है वो राइट साइड से आती है. इसको हम ट्रांसपोजिशन ऑफ ग्रेड आर्टरीज कहते हैं. तो ऐसे बच्चे काफी सिक होते हैं, ऑक्सीजन लेवल काफी कम होता है, पर इनको भी ट्रीट करने के लिए वन टाइम सर्जरी. एक बार हम सर्जरी कर देंगे, जिसकी धमनियां है उनको स्विच कर देंगे, तो बच्चा आगे जाके पूरी अच्छी तरीके से नॉर्मल लाइफ जीता है.
The surgery is done, the patient is recovered, the child starts doing his breathing and anything in the later stage of his life, redo surgery will be required, or what's some
see, some of the heart defects require multiple stages. There are some heart disease which require 2-stage surgery or 3-stage surgery. One done in the infantile life and the second is done at 4 to 5 years of age. Whereas other heart diseases are usually curative. So once you do the surgery, usually in future the baby does not have any. However, we must always keep the baby on follow-up. They should always be followed up the pediatric cardiologist on advice of the pediatric cardiologist, because some of these heart defects can have problems later on. And we should be vigilant enough to detect them early, so that the treatment can also be given early, so that the baby can live a normal life.
Can a normal person choose to do these surgeries? It's heard that these open heart surgeries are very expensive. So, what is it?
So it is a very common myth that these congenital heart surgeries are expensive. You know, there are various government schemes which are running. The common ones are Rashtriya Swasthya कार्यक्रम, which is a central government scheme, in which the heart disease of these children get treated free of cost at most of the private hospitals. You know, like our hospital is already has a MOU with government of Maharashtra, where children from 80 years of nurse can come in and they can get the surgery done free of cost. For some reason they are not qualifying for this Rashtriya Bal Swasthya कार्यक्रम, then we have various NGOs, and of note, the most common and the most generous of them is probably Rotary Club. So even if the patient's parents they pay say 10% of the package, remaining 90% is chipped in with the Rotary Club as well as a hospital social worker, so that these children can be treated at a very minimum cost. So something like a hole in the heart, even if the parent pays 20,000-25,000, just in case they're not qualifying for an RBS2 scheme, the remaining 3.5 lakhs or 4 lakhs is chipped in with the help of the Rotary Club or other social workers along with the hospital social worker.
Right, yeah. The Rotary Club contributes huge in patient.
Yes. There is a Rotary Club scheme which is called as Changing Living Hearts or something.
So, do IVF babies have a high chance of getting any heart disease?
Yes. In fact, there have been many studies which have been conducted, especially in France, which shows that babies which are born by artificial reproductive techniques, such as in vitro fertilization or any other advanced reproductive techniques, these babies have a higher chance as compared to those with natural conception who develop congenital heart defect. But the key word is detecting them on time. If we are able to detect them when the baby is still in the mother's womb, we can institute the therapy very early in the baby's life, and these babies can also live a real healthy life. So yes, it is more common in babies who are born of artificial reproductive techniques, but if you detect them early, it can be treated appropriately.
That's nice actually, it's a good insight. So doctor, is there any possibility that a young children can get heart attacks? Can they be possible?
So heart attacks are very rare in children as compared to adults. But yes, there are certain children who can develop heart attacks. Well, heart attack by itself is a very broad term. By heart attack, we mean in adults when we mean heart attack, then the blood supply to the heart gets affected, and that is why the heart beating decreases or it stops. In children, most of the times that is not the case. Sometimes these children will have the lung artery pressure which is on the higher side, which we call as hypertension. And in these babies, sometimes their heart can stop suddenly, or they can have syncope or chakkar aapko jo bhi naam bolte hain, wo ho sakta hai. Sometimes children do have problems in their ECG, electrocardiogram. So these are structural or what we call as channelopathies, in which the ECG, there are certain intervals which we calculate, they are longer. And in these babies also there is a risk of sudden cardiac death, so they can die suddenly while climbing upstairs or doing some kind of activity. There are certain other problems like hypertrophic cardiomyopathy, in which the muscle of the heart is very, very thick. These babies are also prone to sudden cardiac death. Very, very rarely the coronary arteries or the arteries which supply the blood to the heart, they are not normally located in the baby. And if they are not normally located, sometimes the blood supply to the heart can get affected and the baby can have a heart attack or a sudden cardiac death.